There is something that has changed post pandemic that very few people are willing to acknowledge. And what I'm here to tell you is that the numbers don't lie. A lot of people are sick, getting sicker, and there is no coherent explanation as to what is going on. I am here to just cut right through the fluffs and start to show you the reality of what is happening across the board. So, for the past few months, I've been working on some research looking at data from NHS hospital admission statistics, huge data pools. And in essence, when I looked through the period from 2016 to 2025, 1,600 ICD codes looking for any significant changes, of which we've found 193 codes that have changed in an unusual way. And I'm here to give you a taste of what that is because this is so important that I'm breaking it out into a series of presentations. The first one will be coming up on the 26th, and you can join me there. The rising heart crisis, cardiovascular disease is surging. And this is likely to be the pattern all across the Western world. I'll not bother to even mention why I think this is happening because it is almost irrelevant to talk about the elephant in the room. At this point, I don't care. I just know we need to see what is happening and figure out what the heck do we do for people who are getting sicker all the time. That's the reality. So when we look at the numbers, they really boggle your mind. Here is just an overview as to some of the things that we're looking at. 89% increase in cardiovascular diseases. For maternal health, 40%, with some of the conditions, gestational hypertension, increasing by 100% in this 5 year period. Metabolic diseases up 78%. These are huge numbers that there has been no attempt to try and explain what in the world is going on. That's where I'm going from a different angle. I'm not going to only show you that this is occurring, I'm going to explain what the mechanism is most likely going to be. Now, people may not necessarily agree with the analysis that I may have. That's fine. Go and do the research yourself. And I guarantee you, there are not many people who are doing this research, have been studying COVID for 6 years, and critically have a deep understanding as to what happens in hospitals. That's what makes me unique with regards to this kind of analysis. Critical information that we all need to be able to understand. What I'll be covering in that presentation, look at the cardiovascular trajectories. Hypertension, 119% increase. Heart failure, arrhythmias, myocarditis, all rising together. We have never seen anything like this before. And this is covering from 2016 all the way to 2025. Something is going on. What is the mechanism? Don't let anyone tell you that this is not happening. This is why I've done this research and gone into the depth that needs to be done, because I don't want people to get away with the idea that, don't worry, things are okay. No, they are not okay. Something is very wrong. People may not want to look at the causes because it will hit on ideological perspectives. That's a different issue. But when it comes to the data and the science and what exactly is happening, you can't deny it. When we think about one of the most sacred areas of medicine in terms of pregnancy, when you look at these numbers and you realize the implications of what has happened in the pandemic, you will see why this is such a serious issue. Look at this. This is just about maternal and obstetric and trajectories. Gestational hypertension, that means blood pressure rises in pregnancy where they need treatment, 100% increase. Pre-existing hypertension that complicates pregnancy, 136% increase. These numbers are off the scale. Off the scale. This is real. The cause we can argue about, and this is where, when I do my presentations, you have to join in. If you've just joined me now, remember, look in the description below. The first one I'm tackling is the heart crisis. I'll be going through each one of them sequence by sequence, because there are relevant factors that are occurring across the population that will impact on health. This is why you are finding so many people struggling with their blood pressure. If you already have hypertension, this is why the medication doesn't seem to be working as well. You need to understand the science, because it has direct relevance to longer term outcomes. Metabolic and endocrine trajectories. This is another one that I'm touching on. Type 2 diabetes up 57%. Vitamin B deficiency up 153%. What in the world is going on? Why, oh, why is that happening? Vitamin D is following a similar trajectory as well. These are very unusual patterns. This is not what you would expect if things have gone back to normal. Something is still very wrong. And as I said, the science behind it, I have been talking about for 6 years. Once you understand the spike protein, once you understand that the immune response to the spike protein is likely to drive unusual patterns in disease, everything makes sense. You just have to put on that lens. If you don't, nothing makes sense. Don't believe me, think this is just my opinion. Take a look at this. Immune and inflammatory disease trajectories. Oh my goodness. Ulcerative colitis up 73%, Crohn's disease up 48%, systemic lupus up 66%. This is like nothing we have ever seen before, and it is not peaking. This is on a continuous rise. It is no wonder so many people are getting sick. And it is no wonder when I talk about excess deaths, it has to become an issue. There is no way you can have this kind of surge of disease across the population. That's the morbidity. It has to eventually become mortality. So we are going to see surges of death in the longer term. We have got to find ways to mitigate it. This is not the time for ideological concerns. We just have to look at everything that is on the table, come up with solutions, and try and find ways out. Look at neurology, the multiple sclerosis up 31%, demyelination up 48%. I mean, so many people are having unusual neurological patterns. What is going on? Again, if you take the autoimmune paradigm, everything makes sense. This kind of information, is literally going to become the linchpin for many corporate institutions to try and understand what is happening. I'm just sharing this with you now because I always share my information with you. But this kind of information, you will not see this anywhere else, because nobody else seems to have done this kind of work. Not only the work, but the analysis of these patterns. And this is what I'm saying I'll be doing in the near future. Look at what's happening to kidney disease. Chronic kidney disease up 38%, nephritis up 84%, drug-induced nephritis, very interesting, up 63%. It suggests the kidneys are vulnerable. You can see the trajectory going off the scale. I'm telling you, look at this. Just imagine where this is going to be in another 5 years. How are health systems going to cope with that many people getting sick? We will not have enough resources for the people who are getting sick. You may not think it's directly relevant to you now, but this is by far probably one of the most serious issues that will face people. Now, I guess if you're in your 20s, you're not too worried. But if you are 50 and above, and you are coming into that period of time where your health is critical and you are likely to need access to health-related services, you better pay attention. This is serious stuff. and we need to find ways to mitigate it. At least if you understand, you have a chance. Imagine all those people who are just walking along, hoping for the best, walking into this nightmare, this storm of disease that is coming upon us. So make sure, look in the description below. We have this presentation. There are free tickets. We have some free tickets. There are donation tickets. There are full price tickets. Whatever you can do to support this kind of research is appreciated. So please join us in this journey. This is just the start of a multi-week discussion on multiple layers of health-related conditions. By the end of it, I expect anyone who has been listening to be an expert, to understand why so many people are getting sick, and hopefully have some strategies to mitigate against it. Thank you for watching with me. Look forward to bringing you important information in the near future. Have a great evening.